I spoke to Northern Ireland's mental health champion, Professor Siobhan O'Neill, a short time ago. These statistics are stark, and this problem is not just in Belfast, but in hospitals across Northern Ireland.
That's absolutely correct. Yeah, I'm hearing from all different parts of Northern Ireland that people are presenting in significant distress to emergency departments, and it's not acceptable. Of course, we need better services in the community so that people have somewhere else to go whenever they're in distress and that they can get the help they need outside of that environment.
So surely this would not be a good environment for someone who is in distress then?
Well, it's the wrong environment. I mean, what we need is a very calm environment where people can receive therapeutic support and follow-up support. So often what happens is that people are discharged and then signposted to services. And what we want to move towards is a system where they get follow-up support so that they can look at what caused that crisis and start to turn things around so that they don't get back in that state again. I mean, unfortunately, many of these people will be presenting again and again and again because they're not getting the right sort of help.
And we've heard people say they feel that they have no option but to go to ED. So what can we do about that?
Well, there are other alternatives available. I mean, we have multi-agency triage teams in some parts of Northern Ireland where there's support on the person's doorstep in the street almost, and that's really good. And we also have alternative spaces that are available, for example, crisis cafe environments and other types of services. So they're an alternative to an emergency department. But unfortunately, if a person's very acutely suicidal, they may need that assessment in an emergency department. So that's not good. It's going to depend on what the individual circumstances are there, really.
There is a mental health strategy. Are you struggling to change things?
Well, one of the actions in the mental health strategy is the creation of a regional crisis intervention service that provides the sort of follow-up care that's needed for people who are in suicidal crisis. Now, that action has been progressed. We're now at the stage where we're starting to pilot elements of that action. Unfortunately, though, we don't have enough money right now to do everything that's needed within that strategy, and that is the problem. So we have the plan to change things, Paul, but we just need the investment so that we can fast track that plan and get some progress.
One final question, and briefly please, with no minister, no executive and no money, where do we go from here?
Well, we do need to invest in early intervention and prevention as well. And there are a number of initiatives that are happening to try and ensure that people get the right source of help at an earlier stage. But ultimately, we do need that leadership. We do need investment in the mental health strategy. And we need to look at creative ways of finding that money if it's not readily available. This is the one part of health where we do have a plan to transform things. We just need action now and resources.